This week, President Joe Biden revealed a plan to lower the cost of 10 prescription drugs for seniors, allowing Medicare to negotiate the price with drug companies. But what impact will that have on people here in Maine? Well, News Center Maine's Alex Haskell looks into it.
Dr. Karen Saylor says her patients sometimes have to choose between paying large amounts of money for important medications or not take them at all.
These are drugs that every drug in that class is similarly priced, so they have very few options.
Saylor says she's even stopped prescribing some pricey medications to patients.
It is prohibitively expensive, and I've never met a Medicare recipient who has it covered.
But that might change. 10 drugs could have their prices slashed in negotiations between the government and drug manufacturers, authorized by the Inflation Reduction Act passed by Congress last year.
Big Pharma charges Americans more than 3 times what they charge other countries simply because they could. And I think it's outrageous. That's why these negotiations matter.
The effects of this change is expected to be wide-reaching here in Maine.
In the first 10 drugs, there are thousands of Maine people that are already subscribing or using those drugs.
Maine Senator Angus King says Medicare enrollees taking the medications here in the state paid out-of-pocket costs of up to nearly $5,000 last year.
This is just fixing a mistake that was in the law, I believe, when it was first passed to provide benefits to Medicare recipients, because it prohibited, if you could believe it, the law prohibited Medicare from negotiating with pharmaceutical companies.
Savings for the 10 drugs won't come until 2026, but for Dr. Saylor's patients, she says it will be worth the wait.
If this goes through, this is going to have a major impact on my patients and a trickle-down effect, I think, for other patients as well.
Alex Haskell, News Center, Maine.
Now, the road ahead for this proposal won't be an easy one. Multiple major drug companies are already suing or planning to sue to stop the plan. They say Medicare doesn't have the authority to negotiate prices.